Hi, and thank you for taking the time to go through this brief training with regards to the survey, A Community Approach to Understanding Homelessness in Cumberland County. My name is Alison Ladd, and I'm the Community Support Coordinator at the YMCA of Cumberland.
And I'm Janine DeWitt, and I'm a health promoter with Public Health.
This survey is a collaboration between Public Health and the YMCA of Cumberland.
So to start the presentation, we'd like to go over the background and approach for our initiative. And what we're doing is a service-based approach to understanding homelessness in Cumberland County. And the reason why this approach has been chosen is because it is most effective in capturing homelessness in rural areas. And as we know, homelessness in our rural area of Cumberland County is often hidden. This approach is intended to give a snapshot or a better understanding of those experiencing homelessness over a 30-day time period. And how it captures this is through frontline service providers who are most likely to come in contact with individuals experiencing homelessness. And the reason why we have chosen to do this in Cumberland County is because it was effective in Cape Breton in 2016 and 2018 and helping them mobilize effective work to help address the issue.
So the service providers who we have reached out to and who we have participation from come from a wide variety of backgrounds, including housing and shelters, health, mental health and addiction services, justice with the probationary services, income and employment services, including groups such as Cancer and Nova Scotia Works, a multitude of different community-based agencies, churches, obviously the YMCA, and some post-secondary and schools as well.
So the benefits of the study, we're really hoping that the data will help bring a more comprehensive picture of what homelessness looks like in Cumberland County. And with this enhanced understanding, our services and organizations will be better equipped on how to identify and address the gaps and perpetual barriers that individuals are facing to secure housing.
So the goals of the study, we have 4 goals, and they've been set up in order to answer the overarching question of the study, which is what is the prevalence of homelessness in Cumberland County? So the study goals, as you can see, are to develop a more thorough understanding of the nature of homelessness in Cumberland County, to count and identify issues related to homelessness in Cumberland County, gather demographic and other relevant information on the state of homelessness in Cumberland County, and to contribute to identifying gaps in services for homeless populations.
So in order to address these goals, we're planning to embark on the study from October 15th to November 15th as our 30-day time period. As Allison mentioned, a wide range across all sectors have agreed to participate, and we have over 60 organizations and partners with frontline service providers that are participating in the study. We have applied for ethics approval through the Nova Scotia Health Authority, and this application is pending. However, we don't anticipate we will have any trouble as it is a clone study to the one that was done in Cape Breton.
So the way that we're going to be collecting data is through a survey that will be distributed to your organizations closer to the October 15th start date. The purpose of this survey is to screen current and new client charts for those that meet the inclusion criteria. So the emphasis is on the fact that this is only for clients who you meet or interact with during the October 15th to November 15th time period. You don't need to go back into your records to look for clients who you may have interacted with in the past who fit the inclusion criteria. So the inclusion criteria, The first one is that the client is located or residing within Cumberland County. So that will include transient population who are in Cumberland County. This won't include people who call from, say, Moncton and say that they are looking to move to Cumberland County, because at that point they are not within Cumberland County. The client also needs to meet one of the following housing situations. These typology come from the Canadian Observatory on Homelessness. So currently unsheltered, currently emergency sheltered, currently provisionally accommodated, and the client is currently under institutional care with no subsequent residence identified. So a couple of things to point out. Currently unsheltered is sleeping rough or in places not intended for human habitation. Some accommodations around Cumberland County may not be fit for human habitation, but unfortunately they are intended for human habitation. So if people are residing within accommodations that are intended for human habitation, irregardless of whether they're fit for human habitation, then that would, they are currently sheltered. Currently provisionally accommodated would be a temporary stay in a boarding house. For some people, a boarding house is their permanent residence, and they would not fall under provisionally accommodated because they stay there long term. The people who are just there for a couple of weeks whilst they find somewhere else, or they're just staying there overnight whilst they're looking for permanent residence, that would be where they would fall under temporary stay in a boarding house. And the emphasis currently under institutional care is that there is no subsequent residence identified once they are discharged or released from the institutional care that they're in.
Okay, so once we've identified that an individual that you've come in contact with fits both of the inclusion criteria, we then need to assign a unique identifier. And the purpose of the unique identifier is twofold. It will be used to maintain client confidentiality and to help avoid double counting across service providers throughout the study. So how we are going to apply the unique identifier, we are going to use the last two letters of the last name, last two letters of the first name, year of birth, and gender, male, female, or other. If the gender is unknown or the individual has not identified, then simply use both. And also to note, if you don't know the birth date, you can leave that blank and just use the first and last name and how you've identified their gender. For clients that may want to remain anonymous, and we understand that that is quite common with many service providers or services offered throughout the county. So meaning they do not provide a name, first or last name, and a birth date. We are asking that you use JDOE, JDOE 111, and then identify their gender at the end to the best of your judgment. So for example, for a female that you've had contact with that is completely anonymous, you would use the identifier JDOE111F at the top of their survey. And again, the purpose of this is so that if an individual accesses services at 2 or 3 different locations throughout the 30-day period, they will not be double counted in our study.
So the survey is going to be completed based upon knowledge that you have about the client. And the survey should only be completed for clients within the October 15th to November 15th timeframe. Client contact could include in-person, email or social media, telephone or text, or any other means that people get in contact with you personally. The method of collecting information is considered to be a chart review. So you will be working from the data that you already collect on the clients, such as demographics and housing situations. please don't go back to the clients or connect with them afterwards to ask them any questions that you don't have answers to, or to actually sit down and complete the survey with them. Once you have completed the survey, please put it in an envelope and safely store it. When you are popping the survey in the envelope, please don't put in with the survey the sheet on how to create the unique identifier. We've identified this as one of our data privacy safeguards, so that if the sheet is not in the envelope with the survey, if the envelope somehow happened to fall into the wrong hands, the individual wouldn't be able to understand how the unique identifier was created.
So just a few additional considerations with this study. One thing we really like to draw attention to is that the questionnaire will take no longer than 5 minutes to complete, and you'll receive a good understanding of that when we go through the questionnaire fully at the end of this presentation. We ask that you please complete a survey for all present when seeking services, not including dependents. So for example, if you were working with a couple, you would complete a survey for both of those that you were seeing at that time. But if they had shared with you during that interaction that they have 2 children or 2 dependents at home, you do not complete a survey for them. Question number 6 on our survey would allow you to capture those individuals, and therefore we could add them to the count as well. And one thing to note, and is a very common question throughout our training, is that there's very minimal risk of the study. Therefore, consent is not required from the clients. And as Allison mentioned, it's a chart review process. So just reviewing information that we would normally collect. And because the data is in the most de-identified form possible, there is no way to trace it back to the individual. The benefits greatly outweigh any potential harm for the secondary use of data. If you do have any questions about the consent and waiver of consent, please feel free to reach out, and we're happy to clarify any questions you may have.
Okay, so moving on to the survey itself. So this is the first page of the survey. At the top is the organization name. That is the organization that you work for or volunteer at. The department, if you have a department within your organization, please feel free to fill that section in. If you do not have a department, that can be left blank. The client location is the location that the client is currently at. Not the location of your organization, but where the client is currently residing or inhabiting. And the date completed is obviously the date that you are sitting down and filling in the survey. The preference would be that the date completed would be the same date that you saw the individual. Underneath that is the confidential identification number, which we discussed earlier. And then the study criteria that were also discussed earlier as well.
So moving on to page 2 of the survey, you can see that question number 3 is regarding the client's current housing situation as well. And this question is poised to gain a better understanding or zoom in a little bit more on what their housing situation looks like. So a few things to note here with the correctional facility, mental health facility, addictions, and acute care or hospital. Important to specify here that when an individual is being discharged, that they don't have an address to move to upon release, as well as two things to differentiate between, you can see they're living with friends, family, couch surfing, or living with family with no subsequent address to move home to. So obviously a temporary stay with family as they are trying to find more secure housing. Question number 4 is looking at the client's age or year of birth. So you'll see there's 2 options. If you do know their year of birth, please fill that in. If you don't, feel free to leave that blank, and below you'll see that there's age groupings that if you feel you have a good idea of an estimate of where their age may fall, please select the one that fits best. Question number 5, being the marital status. If you know, please select one, and if you don't, please select no information available. And as mentioned earlier, question number 6 is addressing if the client has a children or dependents. So if they do, and you know of the number, please share that and their current childcare arrangements.
Okay, so this next page on the survey is where our survey slightly deviates from the survey that was done up in Cape Breton in 2016 and 2018. We thought it was important information to gather regarding where the client was from and how the client came to Canada, and if they came to Canada as an immigrant, a refugee, or a refugee claimant. We're finding nowadays in homelessness counts that are being done that refugees and immigrants are being found in higher numbers than Canadians who were born within the country. The next question is regarding how the client identifies, if they identify as having indigenous ancestry. If they do, please check the if no, check the no box. If yes, please specify First Nation, Métis, Inuit, or if you don't have any further information about their Indigenous ancestry, please check the no information available box. Again, the reason that we're including this is because people who identify as Indigenous are grossly overrepresented in homeless studies. So we want to be able to have this data to contribute to the overall picture nationally. The next question, number 10, employment status. Fairly simple, check which one applies. The question of enrolled in childcare or preschool, for those of you whose clients would fall within the childcare or preschool category, please check that. Question number 11, in the same vein as the other populations being overrepresented in homelessness counts, veterans of the Canadian military and the RCMP and police are generally found to be of a higher number than their civilian counterparts. So please, if they did have any service in the Canadian military, RCMP or police, please check those boxes. And then question number 12, check all that apply in terms of where the client obtains their income.
Great, so moving on to the last page of the survey, you can see that question number 13 is regarding the highest level of education that the client attended. So if this information is at your hands, please select the one that best fits to your knowledge. Question number 14, what reason or reasons contribute the most to the client losing or being unable to find and secure housing? Check all that apply. Housing does not include temporary arrangements or shelter stays or couch surfing. So one key thing to really point out here is the contributions and the barriers, not only being able to find housing, but to secure housing. And what we really hope to learn more about here are what are the common barriers that individuals face. So you can see here, there's a few options to select. If from your encounter with your client or the individual, you don't see something that fits within these boxes, we strongly encourage you to use the other option and then provide any further details. So for example, one thing that you don't see here is specific to discrimination, which can be quite broad. But if you do have a good understanding, or you did gather a good understanding of an instance where a client received discrimination of any kind, so this may be, it may be because of their age, maybe because they have children, their gender, their sexual orientation. So if you've gathered a good grasp of this from your encounter with a client, we would like to hear more of that and identify it in this question. And in question number 15, an opportunity, as alluded to earlier in the presentation, this question is really an opportunity to provide any more details. So this would be a good opportunity that if the client had been part of the transient population and they were in Cumberland and you gathered more information, or with their unique identifier, they were someone who'd like to remain anonymous and you use the J Doe, if there's any more details you'd like to elaborate on there, or anything else that you feel was pertinent that you learned from your interaction with the client that might be helpful to gather, please use this question to offer more details.
Okay, so that is the end of the survey. Just moving on to some quick data management and analysis pieces. The data will be entered and stored into RedCap, which is an NSHA secure web-based platform. The software is behind the NSHA firewall. All of the data will be entered by Janine and myself. No one else will see the hard data, the paper copies of the data. The data, once it's been entered in, the unique identifier will be removed. So if there is a John Smith, and there were 4 surveys completed for John Smith would then become, for example, 14A, B, C, and D. So the unique identifier will become obsolete. And once the data is entered in and is de-identifiable, it's going to be analyzed by the NSHA Research Methods Unit using descriptive statistics. So ratios, percentages, numbers, and nothing that in any way, shape or form would be able to identify any of the people whose information has been used within this survey. Community organizations who provide 10 or more surveys will receive an agency-specific report of findings from their organization. Once the study findings are finalized, we will be sharing back the findings with the community. And a couple of things with regards to data privacy and safeguards. So we've discussed before, Janine and I will be the only ones picking the data up and seeing the data. So if you do have any questions with regards to the data privacy, please don't hesitate to contact us. We'd be more than happy to go into more details with regards to these things.
Great, so that wraps up our overview of the study and the questionnaire and survey that we are asking individuals to consider within their interactions from October 15th to November 15th. We really thank you for taking the time to listen to this training session. We encourage you to share it throughout your organization with other frontline service providers that it would relate to. And we strongly encourage you, if you have any questions either from the training presentation or about the process or even throughout the study period, to contact Allison or myself. We are at your disposal and happy to support in any way that we can. And on behalf of our partnership, we thank you for your participation in this study as it's of great importance to our communities.